the years, MS Teamworks has shared perspectives on MS from all members of the MS team. And although 2020 brought unexpected challenges, we were determined that a pandemic and social distancing would not stop us from sharing new and meaningful perspectives. The setting was different, but the message is the same. I have MS. I have a team. I have a future.
My name is Dr. Adam Kaplan. I'm the primary psychiatric consultant to the Johns Hopkins Multiple Sclerosis Center of Excellence. So I began working with people living with MS originally because when I graduated from my residency and postdoctoral training in neuropsychiatry, my goal was to try to address depression. Depression is a horrible disease. It's the second leading cause of death in the United States up to the age of 45 is suicide. It has a horrible impact on people's lives and their loved ones' lives. The problem is that in order to study depression, you need to try to narrow it down to a population that's homogeneous, because it's sort of like if I gave an antibiotic to everybody who coughs, I'm not going to be able to show that this antibiotic works because people cough for many different reasons. So I went to MS because MS has the highest rate of depression of any medical, neurological, or surgical disease. And in fact, it turns out that MS has been a perfect model to understand the way the immune system, when activated, leads to depression as one of the final common pathways of inflammation affecting the brain. So what is depression? Depression is actually a constellation of symptoms. So what I tell my medical students and residents is that depression has sadness associated with it, but it's not just sadness, and sometimes sadness isn't even the cardinal symptom. So really, sadness is to depression what cough is to pneumonia. Lots of people cough for many reasons, and that's not pneumonia. You have to consider the company that the cough keeps. So if it's a rapid breathing, what's called tachypnea, rapid breathing, fever, consolidation on an x-ray, a fluffy area with the cough, we call that pneumonia. Sadness is one of the symptoms of depression, and the rest of the symptoms basically involve trouble with sleep, loss of interest, feelings of guilt, low energy, low mood, concentration problems, not being your normal bubbly self, what's called psychomotor retardation, and then thoughts of death. You only need to have 5 of 9 of those symptoms for greater than 2 weeks, one of which must be decreased interest or decreased mood. The more symptoms you have, the more likely you are to respond to antidepressant treatment. So these are the things that a mental health professional are trained to be able to diagnose based on this constellation of symptoms. And it's not just normal sadness. And it's not, gee, you'd be depressed too if you had MS, because many people, most people, are able to live full lives and find their way through life under altered circumstances when their depression is treated. So having MS obviously has many different aspects that it affects. It affects people's ability to sense, and often they get pain from that. Their motor functions are affected, so movement. Autonomic nervous system is involved often, so you have effects on people's bowel, bladder, and sexual function. Depression is yet just one other aspect of when MS becomes activated and the immune system becomes activated, that it causes depression in 50% of people with MS. And it has devastating consequences. So for instance, depression is the #1 correlate of quality of life for people with multiple sclerosis. And it is also the #1 correlate of quality of life for their loved ones, because it's very hard to be taking care of someone with MS or to have it. But when you add depression in, it just amplifies all of the difficulties. So it has a profound impact on people's quality of life, but also their life. So depression ends up being the second leading cause of death, as I mentioned, across the ages of 10 to 45. In MS, it's probably the #1 cause of death in that age range. And it's the 3rd leading cause of death across the entire age range for MS. To give you an idea of how prevalent that is, 30% of people with MS will have thoughts of killing themselves. 10% will actually make an attempt. And that's devastating because this is the most treatable, or one of the most treatable aspects of MS. So the profound impact is both on people's quality of life and their longevity, how it affects them. The other thing that's important to know is that MS causes the depression. Depression worsens the MS. So one of the things you have to be aware of is that the worse your MS, the worse your depression, and the worse your depression, the worse your MS will become. So it's a kind of a bidirectional interaction. It turns out that of all of the aspects of MS, in terms of the degree of disability people get, because when people get depressed, they're often in bed, they can't work, they can't carry out their roles as friends, parents, coworkers. It has a profound impact on people's function. And when you compare that to other aspects of MS, cognitive impairment, fatigue, difficulty with pain, all of those other things, they're all very hard to treat. However, depression, when I treat a patient with MS who has depression, my goal is to get them 100% well from their depression. Back to their old selves is what the goal is. And I can achieve that in probably better than 90% of cases. Sometimes I have to settle for only getting person most of the way well most of the time, but the goal is to get them all the way well. And it's very hard to get someone all the way well from the other aspects of MS like fatigue and cognitive impairment and motor problems. So, but what's also very important to realize is that it turns out the same treatments that we've been using for 60 years plus, the antidepressants, all of them have an anti-inflammatory effect. So it was originally shown with Prozac. Prozac in a double-blind study decreased in patients who did not have depression, just people with MS. In a double-blind study, Prozac was able to decrease the number of lesions, new enhancing lesions that patients with MS get in their brain. And so it really is important to realize that the treatments that we use to treat depression turn out to have side benefits for people's immune system. As I tell my patients, one of my responsibilities is to meet with their care partners. And the reason why that is it's hard to be, up a creek if you have MS. It's even worse to be up a creek without a paddle. So, the people who we rely on when we're sick or need help, the in sickness and in health clause of the marriage contract, it's very important to realize that keeping them well, healthy, and having sufficient confidence and patience in helping to handle what comes for them and the patients is critical. And there's almost a universal response that I've seen in the care takers of patients with MS. There's a guilt, a survivor's guilt, if you will, that they do not have the illness, but they don't feel okay going out, meeting with their friends, going to movies, going for a manicure for a woman or a drink out, with the boys at the, to watch a game for the men. And so what's important, and I tell them, is you need to go do that, not for yourself. You need to go do that for your loved one with MS. And the best analogy is we are all told when we're flying on an airplane, the oxygen mask dropped down. Who are you going to put it on first, yourself or your loved ones? You have to put it on yourself first. The reason why is, with the oxygen sucked out of the plane, your loved ones will be screaming. You'll be fighting with them to get it on. You'll pass out. They'll pass out. Nobody will make it. However, if you put it on yourself, you will have the opportunity to help them or just, wait a little while. They'll pass out right next to you and you're there to put it on them. Just depends on your style. But the important thing to know is that you need to have your reserve. You need to make sure your health is okay. Don't cut going to the doctors, exercising, keeping yourself well, and making sure that at least once or twice a week, you do go out just to recharge your engines. I mean, so many success stories to share. It's hard to know which one to pick. I think that just yesterday I saw two patients, but one stands out for me, which is it's a patient who was a scientist working in a lab doing research, got MS, and in addition to the MS, the depression had come for her. And unfortunately, her depression was associated with a significant cognitive impairment. So she actually had to go on disability, and she had stopped dating and had not been dating in a long time. So it actually is more complicated. It turns out, believe it or not, depression is even a risk factor for getting MS. And she had been depressed for quite some time. And in fact, the year that her MS started was when she had had the worst depression. So what was really gratifying is after working with her for basically 3 months, she started to be dramatically better. By 6 months, she was now reporting that she was able to go back to work. So you never know how much of the cognitive impairment could be due to the MS or due to the depression, but I promise you treating the depression is much easier. And if you treat the depression, the cognitive impairment from the depression will go away. Her cognition improved on average 40%. In some areas, it doubled. So it was really critical to get her depression under control. So she was able to get off disability, and she's back out and dating and moving forward with her life. She can't remember being as well as she is now. And that is just so rewarding to take somebody who has been living so long with the depression, they've even forgotten what it was like. It becomes sort of the backdrop, the background of their life, and they often cut out and make room for it in their life rather than realize that they can get it treated and remove the depression. So that was very, very rewarding just to see how much she's been able to do and move forward with her life. When people originally are diagnosed with MS and they come in, they're often devastated for reasons of, they don't know what's ahead. It seems something that they haven't been educated about. And so the mantra I have for my patients are to accept, adapt, and achieve. Those are the 3 A's. And I've actually gotten those from a dear friend of mine. And Luby is her name. And we kind of work to mold them and enhance them a bit. But basically, the idea is that when people come in, they originally are fighting for, what is going on, how is it happening, and they have to just accept what is going on. They have the MS. They're going to grieve over being healthy without any illness. This is hopefully, lightning didn't strike twice, hopefully, so the first major illness. And they have to just accept that this is one thing that they're going to have to live with. But, none of us have a guaranteed, none of us are getting out of this world alive. And eventually people are going to have to make an adjustment. So in order to make the adjustment, you have to accept this is my life under altered circumstances. You then have to adapt to, gee, if I can't shop without a walker, now I have to adapt to using the cart when I go shopping as my walker, kind of learning some of the tricks of the trade. And then once you've done those, you can then achieve. And that's kind of the order in which people have to go. What I tell people is life is really about the connections we make. And the first thing I tell them is the connection to themselves really is forgiveness, because there's this inevitable thing that many people have where they blame themselves. What could I have possibly done to bring this illness on to myself? And so you have to forgive yourself. There's nothing you did, nothing you could have done to know that this was going to happen. And that connects us to ourselves. You have to have forgiveness first. Second thing is to connect us to others. Really, gratitude is the thing. Just be grateful once a day to the things that you have, the things that you learned. And in fact, many people with MS will describe having learned to be a more compassionate, empathetic human being and to help other people more through showing that you can overcome what they've learned to overcome. They can teach others. So gratitude is what connects us to other people. And finally, purpose in life is what connects other people to us. So you have to find what it is that your purpose now is. And often that means changing what your original purpose was to something new, something that will help you, guide you as you move forward. And we know that having a higher purpose in life correlates with a much better health outcome. And that is, just the notion that giving back to other people is so rewarding. It has health consequences for us. So those are kind of the important things that I try to tell my patients, is that they have to accept, adapt, and achieve. And then to help with their connections, they have to find forgiveness for themselves, gratitude for other people that connects them to other people, and then purpose in life. I think that my main takeaway is that if you haven't thought of it before, if you don't know anything about depression and some of the things that we've been talking about today or addressing today, if they ring true for you, just realize that this is something that, again, is so treatable, and missing it just means you're going to miss one of the most important and devastating impacts of MS. Treating it will help your MS, and that it is so treatable. It's something that when you recognize it and when you get the adequate treatment, which is both medications and talk therapy, by the way, I might have underplayed those, but the combination is better than either one alone, and that can lead to a full and enriched life. So I think that's really critical.